And a great question. Thank you. Another one here, Karen. I successfully lost weight with Wegovy, reached my target, and then was not be able to prescribe anymore. Appetite came back with abundance. Should there have been a maintenance dose? So with Wegovy, which again is the semaglutide version, it is licensed for weight loss and then also maintenance for about 6 months or so. So again, what can happen sometimes is you go from taking the highest dose medication, then you stop it, and you almost go cold turkey in the sense of your appetite coming back. Now, along your journey, and I'm sure you did, you will have noticed or become, you would have found out about portion size. You would have been eating a lot less. So, but that being said, I completely understand, Karen, the appetite comes back and these things and can start to peter in. So I think there's two things to think about. Number one is when you come to your target weight and where you want to go is to, again, talk to your doctor about how you're going to manage that. Maybe you would actually go down to a lower dose of the medication for a while just to kind of see how they go. But the thing that we tend to say to patients is obviously we're going to learn all the changes that hopefully that you will be able to continue and maintain after you've stopped the medication. But we know, we understand that sometimes things happen and weight does regain. And what's important is to take action early at that stage. So if you notice that your weight is slipping back up because your appetite's coming back, that's the time to reapproach whoever you had your treatment with, whether it was us or elsewhere, to talk about what your options are, because you've done all that hard work to lose weight to a level. Now, at the moment, the medications are not authorized for ongoing or lifelong prescription, so you do have to stop them. But how you stop them, whether you titrate the dose down first, all of those things, are very personal to each person, and again can be absolutely discussed when you get to that point. But it's again, we there's a fantastic database that's actually kept in America, but of patients who have lost a significant amount of weight and have kept it off. Now, actually, a lot of these patients didn't use medications because actually, when this database is spanned from, these medications are relatively new. But the common pattern, they survey these patients every year to find out what they're doing to help keep their weight on target. And some of the things that we know that they all have in common are they remain accountable, so they never stop checking their weight. Now, that's not to say you should weigh yourself every day, but whether it's once a week or once a month, they make sure they stand on the scales or they notice their clothes size is going up. Keep accountable to it. Don't sort of let it slip. But also they have kept up a level of movement. Now, that isn't anything vast or crazy, but they've kept up a level of movement, making sure they're doing that sort of 20 minutes of movement or exercise across the week. So we know that some of those things that are really key to helping maintain the weight you get to are really important, that we ensure that you kind of put in place as you go along your treatment, which again, is why using like the membership resource or appointment with the medical team can help to arm you with those things that we know can really help.